Hello, welcome to another episode of One Leader's Mind. I am so excited today to be talking with Dr. Stephen Schueller, who's a longtime friend of One Mind, the executive director for One Mind PsyberGuide, and associate professor of psychological science and informatics at the University of California, Irvine. Stephen, great to have you today.
Happy to be here, Christina.
I want to start our conversation with a little bit of a grounding for our audience so that they have a sense of the world that you're operating in right now and just how rapidly change is happening in the digital mental health space. You've been at this work for a long time, even prior to your engagement and leadership of One Mind PsyberGuide. So can you zoom out a little bit for us and share some perspective on the expansion of this market over the course of the past 5 to 6 years?
Yeah, well, definitely there's been a long interest in trying to use technology to scale mental health services. Like as long as the internet has existed, people have been trying to think about how to use technologies, early chatbots like Eliza, websites, other ways to kind of disseminate this information. And I think with the advances in technology, these interventions have gotten a lot more robust, a lot more sticky, a lot more engaging. I think the past couple of years has really seen a confluence of a couple things. One is that there has been a lot of investment in this space. We continue to hit new records. The amount of investment in the digital behavioral health space in 2021 is about 10 to 15 times greater than it was even 5 years ago. So it's just a rapid expansion of investment, which means more products and hopefully better products. There's expanding evidence, so we know better about the types of things that work. And the best in class evidence is for digital cognitive behavioral therapy platforms, as well as platforms that integrate some form of human support. So things that have a relationship between technological features and the providers and professionals that are part of these platforms. And we've also seen a changing sort of regulatory and other contextual factors. People are more comfortable with technology and more comfortable getting health resources through technology given the pandemic. There's been changes in regulation to make it easier to be able to provide these services to people. So all of those things coming together have really created this moment right now for digital mental health and digital behavioral health. And I think it's really up to us to figure out okay, now that we have this opportunity, how do we put the best tools in the hands of people who need them?
It's definitely exciting to see so much attention, innovation, and certainly adoption in digital mental health and behavioral health resources. But as you say, that this proliferation of new vendors and products creates an environment that can be really overwhelming for people to navigate, especially for the average consumer. And that's where I think One Mind PsyberGuide, plays such an incredible role and is a really great resource. Can you talk me through how you and your team determine which products to evaluate and then how you actually go about evaluating those apps?
Yeah, so I always say with our process of evaluating, it's a little bit of an art and a little bit of a science. And so the science side is that we do constant environmental scans to look at what are new products that are coming to market, which products are people using, so where are most of the sort of downloads and clicks and usage going. So we want to make sure that if there are products that are being used and adopted either on the consumer side or in the employer side, that we're looking at these products. We also really want to make sure that we're supporting evidence-based practices. So we're looking at the research literature to see which products have rigorous clinical studies behind them demonstrating their effectiveness. So those kind of rise to the top. But we also want to make sure that we have sort of good coverage across different products. So that's a little bit of the art side of making sure if, for example, we don't have a lot of products that are focused on anxiety, for example, that we review some more anxiety products, or if there are products that are Spanish for Spanish speakers in Spanish language, that we review some of those products to fill some of the gaps. We also have a lot of partnerships with different professional organizations. So as one example, we work with the International Obsessive Compulsive Disorder Foundation to be able to review products that they're hearing from their members that are focused on individuals with obsessive compulsive disorder. And so we want to make sure that we kind of fill those gaps. And so when we started that partnership, we reviewed a good amount of products in the for individuals with obsessive compulsive disorder. Or for example, back in 2020, we did a guide to digital tools for employers in collaboration with the Northeast Business Group on Health. And so we spent a lot of time looking at platforms that had B2B models and enterprise solutions, and that the Northeast Business Group on Health were hearing from their members that were products that they were interested in. And so we definitely do listen to some of the different partners and some of the different areas to be able to make sure that those products are reviewed as well.
Thank you for sharing the employer guide. We, from our One Mind at Work members, hear a real shift in how businesses are thinking about the integration of some of these programs and services, and an interest in being more data oriented to their evaluation, which is wonderful progression and evolution in this space. In addition to the employer guide, we also want to make sure that One Mind at Work members know about One Mind CyberGuide in general, because it's such an easy thing for them to share with their employees, to be able to say, there is a resource here that is led by leading researchers in this space that shows a broad spectrum of different products and apps and services that they believe are robust and can really make a difference for everybody across their workforce, regardless of what they may be experiencing in a certain moment in time. So how should our members and other companies be using One Mind CyberGuide for optimal impact for their own workforce?
Yeah, well, I think the first thing I'd like to say about One Mind CyberGuide is just because a product is reviewed on One Mind CyberGuide does not mean that this is a product that we're endorsing. We review products across the continuum of products that are available. Some score high and some don't score high. And so I think really what we recommend is thinking about what are the metrics that are most important to you. And we review products on 3 metrics. We look at credibility. This kind of answers, is it likely that this product will work for me? It's the amount of sort of scientific evidence and the development processes that have been behind that product. We look at the user experience. Is it easy to use, easy to learn? Is it free of technical glitches? And we look at transparency around data security and privacy practices, which is what information do they share about what happens with your data when you enter it into that application? And do those practices that they're sharing, do they align with sort of best practice industry standards in terms of data protection and security? And we call it transparency because we don't do the technical audit itself, but we do review the privacy and terms of services and other policies sort of rigorously to get that information. I also want to make it clear that there's not one app or one product that's going to work for everyone. And so I think that's another reason why we don't, endorse or sort of recommend like a particular product. It's not that like, app A is the best product out there and everyone should use it. People have different needs, people have different interests. And so really what we encourage people to do is to look at a couple different products that are in an area that they're interested in. So if you're looking for a product to help you with depression, put on the filter for apps that are focused on depression. Look at some of the top scoring across these different metrics. What are some of the most credible? What are have some of the best user experience? Look at them and see what ones will resonate with you. And I think that a lot of, just like finding a therapist, sometimes finding a product requires a little bit of, trial and error. You have to make sure that it really does fit with you. And that's one thing that we really do encourage people is that if you try a product and it doesn't seem like it's the best fit for you, that doesn't mean you're hopeless. That doesn't mean that you're beyond help. That just means that you haven't found the right thing for you yet. And the same thing applies in the therapy space too.
2 really incredible points. I think that the first, in just clarifying that a review of an app does not equate to endorsement, is really important, because we want to make sure that we're working in this space from a perspective of credibility and independence. And I think that's what employers are looking for too. They're not looking for the next marketing opportunity or that next commercial service. They're really looking for impact, and they're looking for programs that are going to help their employees. And the second point about not getting discouraged if a specific program doesn't fit your needs. As we've seen, there is so much innovation happening in this space. And I think, one of the things that we can do through One Mind CyberGuide and through our continued conversations around digital mental health support is just to educate people that there are so many different ways for them to engage in these kinds of resources and programs. So thank you for raising both of those 2 points. I want to be sure to highlight a new guide that is going to be coming out soon that I think is really going to be of great use for individuals and organizations as well, for all sizes. And that's a teen mental health guide. It's been hard lately to avoid news about the state of youth and teen mental health. And we have heard from a lot of companies recently that are trying to do more to support their working parents, understanding what people have been navigating at home for the past couple of years, and that there's some fundamental issues of access that are going to take a long time to address. So can you tell us a little bit about how the need for this more focused teen guide emerged?
Yeah, well, and I think that you made a really great point, Christina, about just the real challenges that teens and youth are facing right now in terms of mental health. And I think that the pandemic has shown a spotlight on that, but this is not something that's new because of the pandemic. There was a teen mental health crisis that's been boiling up for years, as we've seen increasing rates of depression, anxiety, suicidal ideation, and unfortunately, suicide attempts, especially by young women in the teenage years. So I think that there's a big need to be able to provide mental health services and resources for teens and youth. And just like access is a problem for mental health services generally, it's especially problematic for teens and youth because we find that there are not enough professionals that have that specific specialization in working with teens and really connecting with them. So at the same time, there's been a growing interest in providing digital solutions for teens, and teens spend a lot of time on technology. They're very comfortable with it. And in some ways, actually, even the privacy and convenience that digital tools offer might be especially appealing for teens and for youth. So with our team at One Mind CyberGuide, we reviewed just under 20 products that are specifically focused on individuals in their teenage years. So these are products that are designed for people who are 13 to 18. And we were doing that because, there are some products that have a little bit of teen content, or maybe teens would use them. But what we've heard on our research side and from doing work with teens is they really want things that are really tailored and specific to them, that speak to the problems that teens are dealing with. And I think that, teens especially are really interested in, holistic, whole person focused care. So it's not just about mental health, it's about physical health, it's about our relationships, it's about identity development and the different things and milestones that people are going through in their teenage years. And so I think that in this guide that we have that will be coming out next month in July, in addition to reviewing these products, we also talked with teens, we talked with professionals who work with teens, we talked with developers who are building teen-focused products to also just provide a scan of the environment and help people understand, where will these products fit in and what are some things to think about as you're considering using a digital solution to help support the mental health of teens.
That's fantastic. Thank you so much for that overview. I know that when this is launched, it's going to be so appreciated and so utilized, again, at the individual consumer level, but also through our One Mind at Work network and our member organizations. We are out of time today. So I want to thank you again so much for speaking with me, for sharing a little bit more about the work that you're leading at One Mind CyberGuide, and just acknowledge the really important work that you're doing to support innovation and evaluation of products and programs in this space. Thank you, Stephen.
My mother has had depression most of her life.
My uncle committed suicide when he was in his 30s.
I live with bipolar.
Now, more than ever, it's the world's leading cause of disability. Yet research to improve mental health lacks the attention physical health research receives. Visit onemind.org. From the lab to the front lines, accelerating brain health for all. Help us fund new treatments at onemind.org.
I'm living my best life.